on legacy data retention. You can use the panel on the right-hand side to enter questions, and we will take Q&A when the presentation is completed. And today I'd like to turn it over to Scott Kidder.
Well, thank you, Shannon, and welcome everyone. If you're planning an upcoming system replacement, or if you've replaced a system in the past and still have legacy data in your old system, then today's presentation is for you, and it should apply to any type of system: revenue cycle, clinical, ERP systems, or HR systems. Our goals today are to provide you with some best practices around options for managing legacy data. And number two, we're going to review a real-world success story. And thirdly, in the end, hopefully you'll come away with this with some thoughts for how to clean up your legacy systems, regain resources dedicated to those systems, and perhaps most importantly, save some money along the way. So let's get started. Don't let risk sneak up on you from behind. As anyone who's been through a system conversion will tell you, these are very complicated and time-consuming projects, regardless of the type of system. And it's interesting times currently, specifically in EMR implementations. Things have changed quite significantly over the past 5 to 7 years. Up until that point, most EMR implementations were a replacement of an existing paper process. Today, almost everyone already has an EMR, so the vast majority of EMR implementations today are a replacement of an existing EMR system. And as difficult as it was to go from paper to electronic records, I would say that it's even more difficult and complex to transition today from one EMR system to another one. And the primary reason for that is the existence of all of this legacy electronic data in the old system that must be dealt with. So if you're replacing a system today, you need to ask yourself, how am I going to handle all of this legacy data? And it's an important question to address, because if you don't, it will eventually sneak up on you from behind, while your focus is 100% on your go-forward solution, as it probably should be. So let's talk about legacy data a little bit more, and specifically let's talk about compliance. The first thing to address is that non-compliance is not an option. If you are legally required to retain a certain set of data and you're unable to produce that data down the road during that time period that you're legally required to retain it for, the consequences could be catastrophic for your organization. So just to put that out there, non-compliance should not even be an item that's under consideration. So with that said, what does it take to comply? Well, interestingly, the laws vary by state, and most states require the data to be retained for at least 7 to 10 years. And if it stopped there, compliance wouldn't be so difficult. But the problem is there are a lot of exceptions to those rules. For example, Medicare or Medicaid patient data must be kept for 10 years, and if you've treated any minors in your facility, you need to keep that data for at least 5 to 10 years past the age of majority, which in some states the age of majority can range from 16 all the way up to 21 years old. And it goes on and on. There are specific data requirements around cancer and other disease registries. So those exceptions are what make compliance more difficult than it should be, perhaps. But the bottom line is you need to understand the requirements for your state and the types of data that exist in your system, and make sure that you have a data retention policy that meets or exceeds all of those minimum requirements. And secondly, you need to make sure that you adhere to it. In most cases, this means holding on to that data for somewhere between 20 and 25 years if you've treated any children. And more we're seeing people decide to simply keep the data forever. This option is growing in popularity given the recent rise in population health analytics and the like. So let's talk about what are the options for complying and retaining that data. Here we're going to walk through 4 of the most common options, and we'll talk a little bit about the pros and cons of each. The first option, and the first choice that many people come to, is converting all of the data. You could certainly take all of the data out of your legacy system and convert it over into your new system. Having everything in one system would be great, and there's no doubt it would be a high physician satisfier for any provider who needs to access that data. The challenge is these kind of conversions are often extremely complicated and extremely costly, and that's if they're even possible. Some of these legacy systems have a different database infrastructure than the new systems, and in those cases, full data conversions aren't even an option. But if it is, it would be great to have it done, but it can be costly and very complicated. The second option is to simply maintain the legacy system. This is often the easiest thing to do because it requires basically no action. You simply keep the old system alive. And frankly, this is where most people land because they're simply overwhelmed with the workload of implementing the new system, and it's not necessarily a bad thing. It can often provide a level of comfort to the users who are moving to a new system to be able to have that old system to go back to access any old data immediately after go live. The challenges with this option tend to grow over time. Number one, the costs for that legacy system don't go away. You'll continue to pay maintenance on that system. And as time goes on, the level of expertise to know how to get in and get data out of those systems will go down, and the risks begin to grow over time as that hardware that it might be living on begins to age. So that's the option to maintain legacy system. As a third option, you could print or export all of your records from your legacy system to paper or into PDF documents. At first, this probably seems like a very low-cost solution as it is, but when you get into it, it becomes costly because of the time requirement to do these kind of exports. It can be very time-consuming. But if you've got a limited number of records, this is a very viable option for you to get those records out and saved. Some drawbacks there are, you got to think of a way to store those records and how you're going to access those going forward. And of course, anything that's discrete in the original system would lose that discreteness as you export those into PDF or paper documents in those. And the fourth option is an electronic archive. It's certainly less costly than a full conversion, and it's less costly than keeping that old system alive and maintaining it for a long period of time. It securely retains all the data, including discrete data, and provides an easy way to get it all out when necessary. So there's definitely some positives there. On the negative side, it is a project. It does require a little bit of cost up front, and it requires some time to get that data moved over into the archive. But generally, there's a pretty significant return on investment. Most customers see a return on investment between around 12 to 24 months by terminating support on that legacy system. And of course, there's always an option to combine several of these to meet your needs long term. So now we're going to talk about a specific case study, and that's exactly what they did. Indiana University Health, IU Health. IU Health is made up of 17 hospitals, over 3,000 beds, and about 175 ambulatory clinics. As you can see here, they serve about 2.5 million patients a year. So in the case of IU Health, they were transitioning all of their legacy systems on the clinical side to Cerner and all of the business systems to Lawson. So all of their hospitals had a variety of systems managing this data in the past. On the acute side, it was McKesson and Meditech, CPSI, HMS, among others. And on the ambulatory side, they had a variety of EMRs there as well, Allscripts, Greenway, eClinicalWorks, NextGen, Misys, all being converted to Cerner. And then on the business side, they had HR applications, Kronos and ADP. Those were being converted to Lawson. And for their specific case, we ended up employing a combination of those solutions we just talked about, and I'm going to walk you through that. Essentially, they converted the high-value clinical data into continuity of care documents, brought that over into Cerner, and then archived the remaining balance of that data. So let's see what that looked like. So in the case of IU Health, on the left, they have an example of one of their many legacy systems, and on the right is their Cerner Go Forward solution. Cerner has a tool called the IHE Gateway that allows them to bring in continuity of care documents. In general terms, most of these legacy systems can generate a CCD document on a one-on-one basis. The challenge comes in when they're trying to convert, hey, we have several thousand patients that we need to generate a CCD on. The systems don't have the capability to do that in bulk, and that's where our expertise came in. We were able to extract this high-value clinical data out, generate a single summary CCD per patient, and deliver that over. And here's kind of what that looked like. So we took that data, copied the clinical data out of the legacy system, convert that over into CCDs, bring that over into the IHE gateway, in this case for Cerner, and then that data becomes available to the provider or anybody using the Cerner application just a click away. So much lower cost than a full data conversion, yet still satisfies the physicians and the clinical need to have access to that legacy data one click away. Now, there's certainly a lot more information in that legacy system than what gets converted into that continuity of care document. So we did then migrate all of the legacy data over into the Health Data Archiver, and then, of course, decommissioned that legacy system and made the archive data available through single sign-on through Cerner as well. So that's a quick summary of how Indiana University Health solved their challenges around legacy data. So what were the outcomes of their specific solution? So in the end, they ended up with all of their legacy systems were decommissioned, and they were able to save a tremendous amount of money in support costs by turning those off as soon as possible. In fact, they had a complete return on investment in about 17 months, so well within that 12 to 24-month window that we normally see. All of the key data, as I just showed you, was available in Cerner via the CCD, and they did so by and still bypassed all of the high cost and complexity of a traditional conversion. All of the data was retained discreetly in a virtual server archive, available both on demand and for any reporting purposes down the road. And in the end, they end up with a single place to go to find all of their legacy clinical information. So they ended up with both a single place to go for all go-forward solutions, Cerner, and a single place to go for all legacy data in the Health Data Archiver. So pretty beneficial for them. So now I wanted to take a few minutes and talk a little bit about not just what we do, but how we do it, because it's important to note. When it comes to archiving legacy systems, we understand that your staff and yourself are going to be focused on your go-forward solution and what that new solution is. So we manage the archive projects end-to-end and are a full-service archive vendor. What that means is that rather than providing you a set of specifications for how you need to get the data to us to be archived, we understand that getting that data out of those source systems is the challenge. So rather than providing you a set of specs, we simply ask for the login and password to that system and database, and we'll go get that data out for you. We've developed the tools to get the data out of those source systems without involving those third-party vendors for the most part. So we'll take ownership of that from that to start and own that project all the way through. And in the end, it really results in minimal involvement on your side to get this data archived. Essentially, we'll go in, we'll do that data extraction. In most cases, we're going to have templates already built for the systems that are going to be archived. We're going to extract that data, bring it over into the archive while your legacy system is still up and running. All that data will be mapped, and once we have it to a point where we're comfortable, we'll bring that back to you for testing and validation. So essentially what you'll do up front is provide us access to that system, turn us loose, and then we'll come back to you when we're done and say, hey, here's what we have produced. You'll compare that against your current legacy system, and once you're comfortable with what's in there, you'll make the decision to say, hey, looks good. We'll approve that. We'll launch the archive, and you'll be on your way and be free to decommission that legacy system as soon as you'd like and stop paying those support costs. And of course, we'll follow up in 30 days just to make sure everything is still to your liking there. So real quick, I thought I'd just show you a couple of screenshots of what the archive looks like. A couple things to note: the archive is a browser-based application. We can host the archive in the cloud for you, or you can deploy it locally if you would like. We do host in most cases. But here you can see the login screen, pretty simple and straightforward. The archive was designed to be very easy to use. Again, we understand that your focus is on your go-forward solution, and if you're going here for legacy data, we wanted to make it as quick and easy to get in, find what you need, and get back out. So once you log in, you'd search for your patient, you'd launch the patient's chart, and here you're going to see an example of, in this case, it's medications. But we've got bookmarks down the left, and all of these bookmarks are going to be dynamic based on what was in the source system. One thing to note here, where we're a little different than a typical data conversion, is that we will actually build the archive based on the field lengths and sizes of the source system, so we can eliminate some of the traditional perils of trying to convert data and fit things into predetermined fields. So the nice thing here is we're going to present it back to you much like it was in the source system, and you'll be able to go in here and find what you need. You can certainly print any individual page, or you could print the entire chart if you need to do that as well. So there's an example of what some discrete medications would look like. In this next example, we've got an example of some scanned documents. So in this particular case, it's an insurance card. Anything that's an image or a document, as we archive that, we convert those over to PDF documents. And those, as in a PDF form, should be easily launchable by anyone without any third-party tools required on anybody's desktop to open those up. So that is a quick overview of the impact of replacing a system and the Health Data Archiver and how we can help with that. And now I'd like to open it up to Shannon for any questions that might have come in.
Sure, and if you have any questions, again, you can just use the panel on the right-hand side to submit them. We do have two, Scott. The first one is, have you ever archived Lawson, and what about Cerner Millennium?
Good questions. Both of those, yes, we have archived. Lawson, as everyone probably knows, is more on the ERP side, so that's certainly a system that we've seen before and we are familiar with and we have archived. In Cerner Millennium, we're actually one of a few organizations who have archived an entire Cerner Millennium application. It's a quite a complex application, and our archival of that is extremely comprehensive and probably the most comprehensive of any that may be out there for that. So those are two very difficult systems, but yes, we've tackled both of those and have a solution for those, as well as many other. We have a long list of systems that we've archived, and certainly happy to share that with anybody that may have questions. But the thing to keep in mind is that we've built a set of tools. As long as we can get to the source data of any system, we should be able to get it out and get it archived. They were all new systems for us at one time, I guess is another way to put it.
Mm-hmm. The second question is about release of information. She just says, can you speak to release of information from the archive?
Good question. That is certainly one of the primary uses of the archive. So the HIM departments, the medical record departments, will be going into the archive because there's a request for that information. In most cases, the data in the archive is static, but there are a couple of for those that need to track release of information, we can certainly track that in the archive via some comments and notes. But when you're going in to get information out of the archive, you can either capture everything on a person's chart, or you could, as we looked at in some of the screenshots, go into individual sections, or on the inpatient side, in many cases, these systems are based on the encounter. So, and the requests often come in based on the encounter as well. So rather than the full person's chart, they may say, I need everything related to this ER visit on November 2nd, 2014. So you'll have the ability in the archive to go and only narrow your information down to just that information related to that encounter and get that out all at once as well. I hope that answers it.
Great. Another question came in about hosting. Do you host or do we?
That's a good question. So yes, we do host. We do provide hosting, and in fact, we host the majority of our clients today. But for anybody that has a requirement to bring the data inside their own data center, we can help you deploy the archive locally as well. All you need is a virtual environment and enough space for the archive, which is often driven on how large the original system is when we get started. In those cases, we simply deliver to you an OVF file that unpacks the application, the database, the operating system, and then you need to give the IP or give the archive an IP address so that your users can access it. But we can help you through that. But as I indicated, in most cases, we would host that for you.
Okay, and again, if you have any questions, you can type them in. It looks like we have one last question about cost. Can you archive multiple systems, and how are these projects priced?
Two great questions. I'm glad those came up because I wanted to mention we definitely can archive multiple systems. And in fact, all of the, while the individual databases are retained separately, all of them are available with one login and search in the archive. So when you log in and search for a patient, John Smith, you will be presented with a set of results that would say that, hey, John has data perhaps in an inpatient CPSI system as well as an outpatient Allscripts system. And so you can see all of those data sources there within the same view. Which is great and very convenient for those in HIM and medical records who need to grab data across multiple systems. So we can bring that that into a single archive there. And then on the pricing side, each individual system is priced individually, and it scales quite nicely. There is a license fee based on the size and complexity of the source system. And then the bulk of the costs are in the professional services for us to do the work of going to get that data out of that source system and bring it over into the archive. But if it's a smaller system, it's quite a bit less effort, so the cost is lower. If it's a larger inpatient, more complex system, the cost is a little bit higher. But that cost is made up of that license fee and those professional services. And then ongoing, there's a very minimal annual support fee. But in the end, the cost to archive, most of our customers will see a return on investment, as I mentioned before, between 12 and 24 months from turning off the support of that legacy system. So a good indicator can often be, hey, look at what somebody might be paying in annual support, and the cost to archive is probably going to be around that or 1 to 2 times that.
That's great. Okay, and that looks like all of the questions we had for today. So I just want to remind everyone that there is a companion white paper that's available for download around this topic of system replacement and its impact on legacy data. And for those of you listening to the recording, that can be found on our website at healthdataarchiver.com, and there's a link right from the homepage to download that paper. And Scott Kidder's contact information is on this last slide, so if you have any additional questions or require more information, you can just call or email Scott at the information provided. So I'd like to thank everyone for joining us today, and thank you, Scott, for the presentation.
Thank you.
Bye-bye.